Thank you so much.
Good morning, I'm Kristen. I'm here to draw your blood today.
Good morning.
Could you please state your name and date of birth?
Pat White, November 11th, 1986.
Thank you. Have you had anything to eat or drink in the last 12 hours?
Not since 9 last night.
Thanks. Do you have any questions?
No.
All right, it will just take me a minute to get everything set.
Blood collection by venipuncture is one of the most common procedures performed in a healthcare setting. Common, but also complex, requiring knowledge and skill to assure the accuracy and integrity of the samples drawn and to eliminate risk to both patient and healthcare workers. The first step is to accurately ID the patient using at least two forms of identification. Does the name and date of birth on the requisition form match what the patient is telling you? Does it match what is on the patient ID wristband? Has the patient followed special orders, such as fasting prior to blood draw? Address the inconsistency first with a requesting physician or healthcare worker on duty. But if the given information does agree, it's time to prepare yourself and the patient for a successful blood draw using proper standard precautions. The phlebotomist washes and then dons a clean pair of gloves before proceeding. Make sure alcohol prep pads, gauze, tape, the correct gauge needles, and required evacuated collection tubes are within easy reach for you, but out of the reach of the patient. Then speak reassuringly to the patient as you position him for the draw.
I'm all set here. If you'd please straighten your arm. It'll just take a moment while I apply the tourniquet.
Applying a tourniquet slows the flow of blood in the veins and increases venous filling, thus making the veins more prominent, easier to locate, and easier to enter. However, leaving the tourniquet on for longer than 1 minute may affect laboratory test results and should therefore be removed and reapplied if the procedure will take longer than 1 minute. Use your fingertip to palpate the antecubital fossa to locate the median cubital vein. Palpation helps determine the direction of blood flow in the vein, to gauge the vein's size and depth, and to estimate its tendency to roll. It also helps differentiate veins from arteries. Unlike veins, arteries have thicker feeling walls and are more elastic to the touch. Use an alcohol prep pad to cleanse the skin around the site. In a fluid, circular motion, swab from the center to the periphery of the site, being careful not to drag the pad back across the cleansed field. Let the area air dry. This prevents contamination of either the patient or the specimen. Grasp the patient's arm firmly with your hand, placing your thumb approximately 2 inches below the intended puncture site. With your thumb, pull the skin taut over the vein to help anchor it in place. Then let the patient know you're ready to make the puncture so the patient won't startle and jump.
You'll feel a slight pinch.
Position the needle bevel side up and line it up with a vein. Position the needle so that it forms a 30-degree angle with the surface of the arm. With a single, short but firm motion, swiftly insert the needle through the skin and into the vein. Push the evacuated tube onto the needle when the needle enters the vein. As the vein aligns with the needle, blood will begin to move out of the vein up into the needle. Maintain a constant, slight forward pressure on the end of the tube. The evacuated tubes are color-coded based on their additives. Know the types of additives and which color tubes are to be drawn based on requisition. As soon as blood begins to flow into the collection tube, instruct the patient to open his hand and remove the tourniquet from his arm. Removing the tourniquet allows the blood to return to its normal rate of flow through the vein and helps reduce bleeding at the puncture site. A gentle mixing by inversion at least 8 times is required to ensure that any additives in the tube are incorporated into the blood sample.
We're almost finished here. Are you doing okay?
Fine.
Engage the safety device on the needle and use the Sharps device for proper disposal. Applying pressure at the needle entry site immediately after removing the needle will prevent a hematoma from forming and allow hemostasis to seal the wound.
keep pressure on the gauze pad for several minutes to ensure that the blood flow stops.
In this illustration, you can see formation of the platelet plug and the fibrin clot. Applying pressure at the needle entry site immediately after removing the needle will prevent a hematoma from forming and allow hemostasis to seal the wound. In this illustration, you can see formation of the platelet plug and fibrin clot. Apply the ID label on the filled evacuation tube and store it for transport to the lab. The label must include at least the patient's ID number, full name, date of birth, and today's date. Using standard precautions, dispose of needles in a sharps container. Dispense of all other used non-sharp materials, including used gloves and gauze pads, in an approved trash receptacle. And disinfect all contaminated surface areas. You've just completed a successful blood draw, providing a sample that can be processed for analysis. Fortunately, most blood draws are completed in an entirely professional, skilled, and successful manner. Most, but not all. Poor technique, poor judgment, lack of knowledge, loss of concentration, and undue haste all are factors that can negatively impact the integrity of a sample. Or worse, that can create undue stress and pain for the patient or cause a patient physical harm. Let's take a look. Failure to align the needle perfectly with the vein and failure to insert the needle at a 30-degree angle can result in the needle missing its mark. Poor technique that will require an unwelcome second needle stick. Inserting the needle at too steep or too shallow an angle and not lining up precisely with the vein are two common reasons for missing the vein. To the patient, that usually means only one thing: further anxiety and discomfort. But it can have other consequences as well. Serious complications are most likely to arise when targeting the basilic vein, with its close proximity to nerves, which can be permanently damaged, or the brachial artery, which could be nicked. Even with a proper angle, the appropriate needle size must be used.
Freddie, you're only going to feel a very small pinch this time.
It is acceptable to use a smaller needle called a butterfly. However, it should be noted that butterflies are a larger gauge needle, 23 to 25 gauge, and therefore have a smaller bore size. A large gauge straight needle, 25 gauge in this case, may make piercing the vein more certain, but as you can see, the smaller bore size can cause the red blood cells to lyse. While it appeared to the healthcare professional that this blood draw was successful, it's clear once the sample is centrifuged that the choice of needle gauge was a poor one. The selection compromised the integrity of the sample. Aside from these two examples of invisible errors, there are many visible signs that a healthcare professional may not be following standard precautions that ensure a quality blood draw as well as a satisfactory customer experience.
All right, you're good to go.
That's it?
Yeah, I just need to put some tape on it. Band-Aid, that'll work.
What about this?
Oh. You're good to go.
Good to go? Not necessarily. Failure to apply pressure on the puncture site immediately following removal of the needle can cause bleeding from the vein into the space around it, forming a hematoma, a collection of blood under the skin surface that will become bruised in appearance and painful to the touch. There are many times, of course, when a single blood draw involves more than the collection of a single sample. You may be required to collect as many as 10 tubes in a single draw, and this requires even greater skill and careful planning to complete successfully. Two keys to a successful multiple tube draw must occur in the planning stage. You need to determine which gauge needle will be appropriate for all tests being requested. And you need to plan the order of the draw to assure the integrity of all samples. But your technique should remain the same. Let's take a few moments to review. Position the needle bevel side up and line it up with a vein. Position the needle to form a 30-degree angle with the surface of the arm. With a single short but firm motion, swiftly insert the needle through the skin and into the vein. Push the evacuated tube onto the needle when the needle enters the vein. As the vein aligns with the needle, blood will begin to move out of the vein up into the needle. Maintain a constant, slight forward pressure on the end of the tube to prevent release of the shutoff valve. As soon as blood begins to flow into the collection tube, instruct the patient to open his hand and remove the tourniquet from his arm. Removing the tourniquet allows the blood to return to its normal rate of flow through the vein and helps reduce bleeding at the puncture site. When performing a multi-tube draw, it is important to follow the correct hospital-mandated order of draw. Blood cultures are always drawn first. However, in a routine venipuncture, a light blue tube should be drawn first, followed by a red top, gold, green, lavender, and gray.
We're almost done here. This is the last tube I need to draw.
When will I know the results? I'm kind of anxious about them.
Your samples will go over to the lab today and your doctor will notify you after the results are in.
You don't see them?
No, I don't. The samples that we draw today are tested by laboratory professionals who relay those results directly to the physician. My responsibility is to assure the quality of the samples I draw so that the results your doctor receives are both accurate and meaningful.
The level of quality and integrity of the samples the laboratory receives is dependent upon the level of skill, knowledge, and professionalism of the phlebotomist. A big responsibility, but one that can make a real difference in the lives of your patients.
Hi, so good afternoon. Ayan. So we need to start na po with our phlebotomy training. So guys, this is a combination po ng lecture and then may video tayo na para mas makita talaga natin no, kung ano talaga yung mga ugat na dapat pong tatamaan. Now with your phlebotomy kasi, no, we will be discussing 4 procedures. So technically, we have here the first topic. We have here the venipuncture to be followed by your ABG. Next, we have the heel prick to be followed by the finger prick procedure. So yun talaga yung package po na tinatawag na phlebotomy po natin. So we have the 4 procedures. So sila po yung focus natin this afternoon. Now, before we begin po, let me share something lang po. Kung ano ba yung mga na-expect lalo na after this training. Kasi after this training po, you will be addressed po na as a phlebotomist na din. Depende din kung let's say kung may mga past experiences ka na ba na let's say nag-withdraw ka no ng blood no, so that's the venipuncture, or nag-perform ka na ba ng ABG na, so ganap ka na phlebotomist. And then you can go business din, pwede the glutas spa no, basta lahat ng spa as long as andun na yung certificate mo, certificate of training. Now with your phlebotomist anatomy kasi, so number 1 na kailangan talagang may calm tone of voice. Dapat relax lang kasi mararamdaman kasi ng pasyente mo din na kinakabahan ka. At sobrang aggressive ka din, parang feeling niya sobrang bigat ng kamay mo. So sige lang, dapat kalmado lang po. No? Kasi we need to pacify our patients din. Kasi this is not an enjoyable din na kasi na procedure, di ba? Lahat po ay nato-traumatize, no? Lalo na pag may needle. Ano nga yung natin guys, na yung kasabihan po natin? The larger the gauge, 'di ba? The smaller the bore sizes, tama ba? And then the lower the number, mas malaki yung bore size na ng needle po natin. So pag sinabi po nating mga needles na let's say pag sinabi nating gauge 18, ano bang mas malaki, gauge 18 or gauge 24? Siyempre, mas talaga yung gauge 18 po natin na kasi syempre ginagamit na po yan na pwedeng yung iba gauge 16 na gauge 18 ginagamit na for OR. Okay? Mga masyadong invasive na mga procedure, pero pag sinabi natin mga gauge 24 for pediatric na meron din tayong mga gauge 22 which is really common din sa ating mga the usual na mga patients po, like mga adult patients po natin. So we need to be compassionate and kind. You need to say thank you, especially pag nag-cooperate po ang patient po natin. Ayan. Next, kailangan may steady hands din kasi malalaman po nila na kinakabahan ng isang tao, lalo na pag biglang nag-vibrate. Bigla ka nagkaroon ng tremor, guys, na nawala ka naman sanang Parkinson's, na pero bigla ka nagkaroon ng mga mga tremors na bigla. Next po, you need to have a sharp mind aside sa sharp needle po natin. Kasi 'di ba the needle, na the bevel should be facing up dapat. Ano ba yung rationale kung bakit yung hiwa it should be facing up? Para kasi na once you cut a vein, guys, dire-diretso yung backflow. Na makikita natin ang backflow agad. Na ayan, na kaya sa hub, 'di ba, makikita natin, wait lang. Oh, check for backflow. Oh, may backflow na po sa hub, then go. Na and then mag-a-advance tayo. Yung iba kasi pag naka-hit lang, pag may backflow na yun na agad, no, mag-a-advance ka pa ng 1 millimeter. Kailangan bang may ruler, sir? No. Estimation 'yan. So we need to be cheerful. Wala akong sinabi na mag-cheer dance ka doon. No? You show your smiles kahit naka-ano ka, kahit naka-mask ka, 'di ba? Smiles ang tawag doon. Na smile with your eyes, 'di ba? For the communication skills kasi, it should be like this. So good morning, let's say good afternoon, Mrs. Ricardo. I am Mark Adlaw, your most responsible phlebotomist. Huwag mo automatic, guys, tanungin na, what's your name po, ma'am? Huwag ganon. Kamustahin mo muna siya. Na meron kasi tayong mga kailangan po na mga itanong sa isang patient. And this is to establish rapport. Aside from establishing rapport then, these are the common questions na pwede pong maging pwede ding alam mo na pang back up later if ever kung may mga tanong ka sa sarili mo, wait lang, bakit kasi sabi niya kanina, na. So number one, you need to ask for the sleep pattern of the patient. Tanungin po natin yan. Next, aside sa sleep pattern, guys, na ayan, no, when was the last time na kumain po, no? Ayan, kasi baka may mga may mga fasting requirements po tayo. So we have the sleep, na, we have the diet. Next, tanungin mo din, guys, na what are the activities prior to this procedure. So we have the activity. Next to activity, next to sleep, na the diet po natin. Ayan, sir, may mga allergies po ba tayo? Ayan, what if kasi may allergy po ang patient natin to iodine? Di ba gagamit tayo ng mga betadine? Lalo na pag may mga culture and sensitivity po ng mga procedure. Betadine kasi ang ginagamit din. Na? So, ayun po. No? So, you ask for allergy. So, ulitin ko ha. You ask for the sleep pattern. Next, you ask for the diet of the patient. Ma'am, when was the last time na kumain ka po? Next, we have the activity. Ma'am, ano ba yung mga activities natin prior to this procedure? Ayan, next. And then we have the allergies po natin. May mga allergies ba, ma'am? No, kasi if you want to know an allergy, guys, na let's say sa sa mga latex, meron kasing technique yan eh. Ano yung technique po na para malaman natin kung may allergy sa latex? Ayan, you simply ask for A, B, C, and K. Letter A for apples. Ma'am, every time ka ba nakakain ng apples, ma'am? May rash ka ba? No? Meron ka bang mga namumula ba ang mo at nahihirapan ka bang huminga? That's for the apples. Next, we have the bananas. Now, if ever kung may allergies po tayo sa bananas. Next, we have the chestnuts. No? Baka may allergies tayo sa chestnuts. And then lastly, yung kiwi po. Na yung kiwi. Hindi yung pang sapatos but rather yung green na maraming seeds. That's the kiwis. If ever po, no, kung yes, sabi niya yes, may mga may mga rash ako right after eating them, then positive po na ang patient natin is allergic to latex. So malamang it should be a non-latex glove. A non-latex din po na tourniquet ang gagamitin po natin. Yes, you heard me right. It shouldn't be pronounced as tourniquet, but rather tourniquet. Sige nga, sabay-sabay tayo, guys. Everybody say tourniquet.
Tourniquet.
Ayan, great po. So it should be tourniquet, not tourniquet, right? Ayan, so we have the sleep pattern, the diet, the activity, and then we have the allergy. Sometimes kasi, it's really traumatizing to patient na, ma'am, pagkapasok mo pa lang, ma'am, may perform kasi kami procedure, ma'am. Na sabi kasi ni doktora ganito, ma'am, no? For hematology po tayo, meaning for CBC, WBC, platelet, etc. No? Huwag ganun, Mars. No? Ayan, dapat kasi i-establish rapport muna. So pagkapasok mo, i-introduce yourself. Good afternoon, Mrs. Ricardo. I am Mark Adlaw, your most responsible phlebotomist. Ayan, I just like to ask, how's your sleep po? Okay? Ayan, kamusta po yung diet natin, ma'am? When was the last time na kumain po tayo? And what was it? And then, may mga activities pa prior to this procedure? Ano ba mga pinagagawa po natin, ma'am? And then, may mga allergies po ba tayo, ma'am? Ayan, let's say sa sa iodine, 'di ba? Ayan, or let's say, 'di ba, pag iodine, ano bang itatanong natin? Seafood, 'di ba? Ma'am, nung kumain ka ba ng whale, ng shark, ng penguin? Grabe ka, mga mammal naman 'yan. Guys, seafood, 'di ba? Like crabs, na shrimps, na etc. Ayan. And then, if ever kung wala naman, another question for the latex naman. Ma'am, nung kumain ka ba ng apples, ng bananas, ng chestnuts, and kiwis, nagkaroon ka ba ng rash? Sabi niya, ha? Mga pagkain ba yan? Na hindi niya kasi alam ang mga pagkain. Sige ma'am, babaguhin ko ang tanong. Nung kumain ka ba ng gloves, no, nagkaroon ka ba ng rash? Grabe ka. Kinakain ba yung gloves? Syempre hindi. No? So apples, bananas, chestnuts, and kiwis po. Kailangan nating itanong yan. Next, the high level of patience. Ito kailangan talaga to. Honestly, kailangan to. For me, why? Ayan, number one, na maaarte ang mga patient natin and mas maaarte ang kanilang mga watcher. Alam mo yung ano, nagse-set up ka pa lang, tapos biglang 'di ba gaganon? Oh, ha? Oh, ma'am, na isang isang tusok lang, ma'am, ha? Kasi pag pangalawang tusok, itutusok ko yan sa mata mo, 'di ba? May mga ganon, guys, na. Tapos yung iba, no, nag-prepare ka lang, no? Tapos parang natagalan ka na mag-prepare, tapos biglang gaganon ang ano, patient or watcher, 'di ba? Tapos parang nahirapan ka na maghanap ng ano ng let's say ng specific vein, no? Tapos nahirapan ka, tapos biglang maririnig mo naman, 'di ba? Yung totoo, te, butiki ka, te. Ayan, parang butiki sa kisame, no? Ayan, and lastly po, kailangan may strong feet kasi hindi lamang isang patient 'yan eh. Ayan, just ano lang let me share this na pag phlebotomist ka po sa States, you will be earning nasa mga 350 to 400,000 na pesos like every month na doon. Pero kasi may mas malaking sahod talaga, guys, pag travel nurse ka. Sa States po, pag travel nurse ka doon, siguro yung 1 million, 2 weeks mo lang yan. Meaning to say, na per week, guys, is 500,000. Okay po? Pero syempre, may mga tax pa yan. Pero, Diyos ko, kung ikaw ba naman magsasahod ng ganon, di ba? So, ayun po, no? Mag-NCLEX na para makapag, maging travel nurse na abroad, na. Ayan, kakalabas lang po ng ex ko, Char, na nurse, guys, na sa Florida. Florida naman siya. Yung waiting period niya, he took the NCLEX po 2 years ago. And ngayon, nasa Florida na po siya. Na, ayan, sobra akong na-amaze. Na, and then, syempre, nagko-communicate pa rin kami na like sa Signal ata, Signal yung namin, gamit na application. Kasi yun pala yung sikat sa States po, the Signal. Hindi yung Viber, no? Wala masyado silang Viber doon, no? Signal ang uso sa kanila. So ayan lang, share ko lang. So ayun pa, these are what na phlebotomist anatomy na dapat i-embody na po natin, na. And ang pinaka-importante sa lahat, guys, na there should be a combination of the knowledge and skills, na. Okay, sama mo na yung attitude din. The KSA, di ba? Ayan, syempre nabuhay tayo sa word na KSA. Knowledge, skills, and attitude, they are so perfect na para maging isang ganap na phlebotomist. Now, sino ba dito ang naka-experience na po kung paano mag-aspirate ng dugo using venipuncture procedure? Meron na po ba dito? Sige nga, pa-heart react nga. Ayan, pa-heart react po ng ating mga naka-experience na. Ayun. Sino na dito, guys, ang naka-experience din ng ABG, ng arterial blood gas na procedure natin, known as the arterial extraction? Meron na din, na mga ICU nurses, dapat kasi magaling po na mag-extract na using the artery. Ayan. So, for a while Ayan. So pag sinabi po nating veins of the arms, kasi you'll be performing the venipuncture. Na ito po yung mga kinakailangan natin na makita ng mga ugat po. Ayan, yung iba kasi sa atin na pag nakahanap ng ugat, na through color sila eh. Wait lang, itong parang nagbo-blue-blue na parang nag-green-green. Ito na yung ugat. Guys, pag magaling ka na phlebotomist po, kakapain mo talaga yan. If that appeared and parang feeling mo parang cord-like, na bouncy-like na parang cord-like using your index finger, do not use your thumb kasi ang daming kalyo niyan. And then may din kasi yan, may pulsation din kasi to. So dapat itong index finger or the pointing finger dapat na i-brush lang po natin. Na gently, softly i-brush mo lang. Na tapos pag may nakapaka ng parang cord-like, na ipe-press-press mo na yan. Okay, it's bouncy. Na, bouncy siya. Ayan, no? So malamang this could be the vein, 'di ba? Ayan, sa vein naman po, pag pinag-usapan po ang vein, guys, 'di ba, syempre ginagamit natin to sa IVT, or in the intravenous insertion, and then pwede rin sa venipuncture. Ang intravenous kasi, the IV kasi guys, yung mga IVT therapy po natin, it's more infusion kasi eh. Diba maglalagay tayo ng fluids. Pero pag sinabi po natin phlebotomy, it's more of the extraction. Mag-extract tayo, kukuha tayo ng dugo. So iba ang training ng IVT, iba din ang training ng phlebotomy. Pero rest assured po na lahat po dito ay updated. Lalo na guys, ngayon bawal na po yung mga inner to outer na pag-cleanse kasi hindi daw natatanggal talaga ang bacteria, no? Or let's say baka may mga viruses din diyan. So dapat i-rub mo talaga. Ira-rub po natin. Nawala na po yung mga concentric, yung inner to outer. Wala na 'yon. Rub na. Na the more may force, the more maganda. Tapos yung iba kasi sa atin na pag-cleanse nila, 'di ba? Titignan nila, just ko tas i-judge ang patient. Grabe ka. Wag na pong tignan. Pagkalilinis mo lang and alam mo naman siguro na madumi yan, 'di ba? Wag mo nang tignan at ipamukha sa kanya na kailangan niyang maligo, no? Just ko red flag po 'yun na. Just ko ang daming mga ganon, no? So ayan guys, we have the veins of the arm. So with the veins of the arm kasi ang pinakauna talaga is the median cubital vein. Ito the median. Ito talaga ang number 1 best site po natin. Because number 1, it's located at the center kasi nga middle median. So nasa middle siya. And then to be followed by the cephalic. Ayan, number 2 po natin of choice po will be the cephalic. And then lastly, will be the basilic. Ayan, careful ka lang sa basilic kasi underneath, the basilic po, meron kasi tayong tinatawag na brachial artery dyan. So akala mo basilic vein yung natusok mo, yun pala, no artery na po. So pag sinabi nating artery, instead of performing venipuncture, baka kasi ABG procedure na ang na-perform po natin. So careful po tayo ha. So again guys, ayan, using your index finger, you brush lang. Huwag pong mag-rely na sa colors kasi sometimes yung iba kasi na they will rely on the colors. Wait lang. Ito ata yun eh. Kasi parang nagva-violet na. Ito ata yun kasi parang nagbo-blue. Ito na yung ugat. No. Sabi nga nila, pag magaling ka na phlebotomist, do not rely on what you see, but rely on what you feel. Sabi. 'Di ba may hugot pa pala ang phlebotomy, no? Wag daw, kasi akala mo yun na, yun pala hindi, na? So hindi pala. So i-sure po natin, 'di ba? You take time. Pero kasi lumalabas lang po ang ugat, guys, na pag mag-a-apply po tayo ng tourniquet. And alam niyo ba, if we're going to apply that tourniquet po, it should be less than 1 minute only. Wanna know why? Kasi pag let's say more than 1 minute ka, na to be specific, no? Kasi pag ganito yan, pag greater than 1 minute po, what happens ba kay patient? Tataas ang cholesterol, ang calcium, no? Mga formed elements po ay tataas. Kaya dapat less than 1 minute lang ang pag-apply ng tourniquet po natin. Don't worry, may videos po tayo later kung paano mag-apply ng tourniquet. Ayan. And then if ever din naman, na kung okay na lahat, na tas may training kami, na hopefully next year, na syempre invite din namin kayo. Para at least makita nyo po no, kung ano yung mga na nagawa po natin online sa actual. Next po guys, we have the arterial puncture. So we have the arteries po natin. Na pag femoral artery kasi na mga doctors na po nagpa-perform dyan. Kasi mas invasive na kasi yan eh. So we have the radial, we have the brachial artery. Itong artery naman guys, na lalo na pa mag-perform tayo ng ABG procedure. The one that is pulsating, the one that is moving, na syempre yun yung ita-target talaga natin. Yun yung tutusukin natin. Kaya with ABG, na ideally kailangan talaga siya ng lidocaine, kailangan talaga siya ng anesthesia, guys. Pero kasi sometimes pag nasa ICU na, they don't need anesthesia na kasi comatose naman si client. Pero ideally, na kailangan may anesthesia talaga yan. Okay po? Kasi manipulate mo yan eh, na yung radial pulse na to. Ayan, dito talaga tayo tutusok, guys, na sa radial artery po natin. Diyan talaga tayo tutusok, na kaya for me, very challenging po ang ABG. Ayan, later malalaman po natin yan sa video kung gaano ba challenging talaga siya. As in like sobrang challenging. Okay, medyo madali lang for me, medyo madali lang talaga ang venipuncture. Like sobrang dali. Pero the ABG kasi, kailangan talagang pipikit ka muna, i-feel mo muna na kung nandun ba talaga yung pulso. Or else, pag wala pong pulso guys, na yung tipong nag-insert ka na, na on a 45-degree angle. Tapos pag hindi mo na hit talaga, tas feeling mo hub is the limit kasi. Na if hub is the limit, na sagad na, tas wala pa rin, so you're going to retract and then you change direction. And then you insert na naman. Tapos pag wala pa rin, you change direction na naman and then you hit. Na sometimes feeling mo na hit mo na talaga yung buto ni patient. Na? Kaya instead of performing ABG, baka intraosseous na yung na-perform po natin. Kaya medyo may pangingilo, ang pangit sa feeling na ayan, ang tinatawag na ABG. Because as an instructor kasi kailangan mo ding ma-ABG. Na? Kaya para at least malaman mo yung pain. Kaya the purpose of having this training din, na kung wala man tayong actual, at least man lang na malaman natin na masakit talaga ang procedure na to. And since masakit po ito, no? So do not prolong the agony. No? Do not prolong the pain po of your patient. Kaya dapat skillful ka dapat na pag phlebotomist ka. Kasi pag gather pa lang ng equipment guys, na dapat kailangan na po no like sobrang meticulous ka na etc. And dapat alam mo kung anong ginagawa po natin. Okay po? For the equipment, ayan, for the equipment guys, these are the BSI or the body substance isolation po natin, na kasama na dito ang gloves natin, na dapat nga may mask din dito na tapos yung face shield po natin, kailangan din yan kasi what if biglang mag-spatter yung dugo? That's what if HIV ang patient po natin positive? So pwede mong ma-acquire yun kahit sa mata, 'di ba? Pwede kasi pumunta yan ng systemic circulation Kasi dapat din kasi may bloodborne pathogen. Although isasama ko na yung mga bloodborne pathogen na discussion later. Tulad ng 'di ba sa HIV, sa syphilis, and of course yung Hep B. Na guys, they are Na they are preventable but they are incurable in nature. Na ayan, lalo na tong dalawa, no? Si Hep B tapos si HIV. Next, we have the tubes po natin. So we have the black tube, the red top, we have the light blue, we have the lavender top. Ano ba yung purpose nila? Meron din tayong video niyan. So we have the bandages, yes. Now we have the tourniquet. Now this is the buckle type. This is the non-latex type. No? That's the buckle type. Although meron naman tayong mga rubber. No? Yung iba doon is with latex. Yung iba naman ay non-latex. So we have the syringe. No? Meron tayong hub. Itong hub natin, lalo na pag mag-vacutainer system po tayo, lalo na yung may mga malaking needles, mamaya, ipapakita natin to. And then of course, requisition form, the povidone iodine, swabs or wipes po natin, then we have the sharps container. Guys, ang technique lang po natin is that, never, ever, ayan, yung iba kasi, Diyos ko, no? Like, alam mo na yung mga, ang dami kasing natutusok talaga Well, hindi na actually issue yan 'di ba? Kaya yung iba nagfi-fish hook, yung iba discard agad na. Ayan, wag na pong ibalik na, wag nang i-recap, 'di ba? Tapo na agad na sa natin sa sharps container. Kasi the more kang magre-recap, Diyos ko Lord, na the more kang na accidental puncture. Tas what if, 'di ba, may bloodborne pathogen ang patient po natin. So sayang lang din. Ayan, so the order of the draw. Ayan, so we have here the order of the draws here. Sige lang, mamaya na i-discuss natin yan with a video. Pero pwede nyo picturean guys. Kasi the order of the draw should be, sa number 1 po natin, ang sabi niya, color varies. Usually for blood culture. This is the yellow to black tube. Isulat ko ha. This is the yellow to black tube. If that's the yellow to black tube, then that's for, syempre, blood culture. Na? Ayan, your light blue, ito naman, for for mga coagulation studies po, na blood coags. Ang red top tube naman natin for hematology, for blood cross-matching. Next, we have the gold. Ang gold kasi guys, pag nasa states tayo, syempre that's for checking of HIV, pag nasa states. Ayan, we have the light green, dark green, yan, for heparin, for lithium, testing po. We have the lavender, of course, for hematology and the blood cross-matching. If we want to know, 'di ba, kung say si patient ba anong blood type ba siya. So cross-matching. Pag gray naman po, syempre this is for glucose, yung HbA1c po natin. So yan lahat guys may po yan madidiscuss po yan mamaya. Mas clear po, Kasi ipapakita niya talaga yung tube, tapos i-demonstrate niya. And then on this side naman po, we have your, di ba, we need to invert. Alam niyo ba kung anong purpose ng inversion ng mga tubes po natin? Di ba yung mga 8 na mga, may mga ganon, the infinity, di ba? Yung mga style na ganon. Pero dapat dahan-dahan lang. Ayan, may mga styles din kasi yan kasi we need to mix it na with okay kung ano ba yung mga additives po na nasa tube po natin. Kasi the purpose of having those okay additives po is to prevent hemolysis. Kaya magulat ka sa mga tube, wait lang, but parang may mga mist to, but parang may mga moisture, mga ganon. Yung iba may mga serum, 'di ba? Mga separator okay ano po, tube. 'Di ba? Parang may mga petroleum jelly na sa loob, na may mga ganon. So mamaya, mas may explain po yan. For a while. Ayan, gamitin na natin tong, okay, isang slide po natin. Ilan na ba tayo? Okay. Yung iba ay na-convince na mag-phlebotomy. Ayan. So we have the phlebotomy. Ayan guys. Na? So, ayan, with this picture kasi, ang tawag dito, this is the vacuum system. Now, your vacuum system kasi, na this will try to what? Na aspirate na blood in multiple draws. Pag sinabi kong multiple draws, kasi ang patient natin for 10 po na examination, 'di ba? For blood culture, for blood coag, 'di ba? For hematology, for HbA1c, etc. Kaya multiple draws 'yan. And alam niyo ba, nagmo-multiple draws lang po tayo lalo na pag maganda ang ugat ng patient natin. So meaning, pag may backflow, tapos pag puno na yon, yung tube natin, kuha na naman ng isang tube. Tapos pasok na naman. Tapos kuha na naman, pasok na naman. Okay po? And that's the vacuum system in multiple draws. Although may order tayo ng draw. Malalaman natin kung bakit kailangan may order of draw. And that is to prevent contamination kasi. And 'di ba, each tube kasi po na has syempre meron siyang mga tinatawag na mga additives. And somehow yung additives kasi pwedeng magkaroon ng problema sa tinatawag na test ni patient. Like for instance, na si guys, pag nauna ang tinatawag na purple, tapos nauna siya sa red, dapat kasi mas mauna dapat yung red kesa sa purple. So, yung red kasi natin for serum and electrolytes din kasi yan. Tapos nauna, yung purple kasi nalito ka. So pinasok mo muna ang lavender, and alam niyo ba ang lavender kasi meron kasi siyang potassium Potassium EDTA kasi siya, So K-EDTA or potassium EDTA. So pagpasok doon, na dapat si red dapat ha. So inuna mo na yung lavender, yung purple. So nag-collect ka na, tas out. Tapos na next na naman po will be the red. So ano ang natira sa tinatawag na na needle? It's the potassium. And alam naman po natin na ang red top tube po natin is for serum and electrolytes din yan. Kaya pag-analyze sa tinatawag na dugo, mataas ang potassium ni patient. So bibigyan siya ng mga gamot tuloy. Honestly, hindi po mataas ang kanyang potassium. Tumaas lang ng dahil sa contamination ng needles po. So we need to prevent needle contamination. Kaya the order of the draw, you need to be very specific. Kaya sometimes nakakatakot ang multiple draws. Pero kailangan kasi yan lalo na pag kailangan ng maraming i-run ang maraming test kay patient po natin. Yeah, sa St. Luke's, very common ang mga multiple draws na to, ang vacuum system na to. Sa hospital niyo ba, can I see some heart reactions po kung very common ba sa inyo ang vacuum system? Meron ba? May nagva-vacuum system? Wala, no? Yeah, bigger hospitals, yes. St. Luke's talaga, doon ko siya na-witness na yung the vacuum system. Ayan, sa hospital ba ni Miss Gabata? Hello, Miss Maria Gabata. Are you using the the multiple draws? Ito, yung ganitong itsura. The
Parang hindi ko
vacuum
po
system.
hindi ko po nakita sa mga medtech namin.
Yes. Usually kasi pag mga bigger hospitals, yeah, and then sa States, no? Or pupunta sa Florida, ang ex ko, Char. Na syempre, nag-training muna kami ng phlebotomy. Training ko muna siya kasi para at least may mga sideline siya doon. Kasi sabi niya, Mark, bakit Mark na lang? Di ba dati ang tawagan natin, babe, Chas? So sabi niya, Mark, turuan mo naman ako na kung paano mo-perform ng phlebotomy. Sabi ko, sige, na walang problema sa akin yan. Ayan. So, ayun po, no? Kinoach ko siya. So, bumili ako ng vacuum thinner system. May mga mabibilan kasi. Amesco drug na medyo madami-dami. Na, although, yeah, not practiced by some hospitals. Pero may mga hospitals na practice po ng vacuum thinner system. And for me, no, biruin mo like 10 na magkakasunod ng mga tubes, 'di ba? Ayan, so kamusta naman yun na procedures? Lalo na kay venipuncture and lalo na kay ABG. Anong tawag natin dito, guys? These are your what?
Hematoma.
Great, ma'am. These are the hematomas, no? Your hematomas kasi, these are collection of dead RBCs. Now, can we prevent hematoma ba? Sabi sa video, yes. As long as you're going to apply, okay, pressure po. No? Ama Maria, okay lang pamagot, ma'am. We pump me, okay lang pong pa-co-host, ma'am. Sorry. Thank you po. Thank you. We pump. Ayan. Thank you, ma'am. Thank you po. So we have here the hematomas po natin. So guys, we can actually prevent hematoma. Na paano ba mag-prevent ng tinatawag na hematoma? You listen carefully. You need to remove, okay, the tourniquet first. Okay, remove. Ayan, tourniquet. Okay, first. Ayan, before removing needle. Before removing, ayan, needle po. Ito yung first na gagawin po natin. Remove the tourniquet first before removing the needle. And that is to prevent hematoma. Kasi yung iba sa atin, di ba nakita niyo ba kanina sa video, ni-remove niya agad ang needle without even removing. You need to puncture. Ayan, puncture at the innermost wall. Innermost, ayan, wall. I'll explain kung saan yung innermost wall po ni patient. And lastly, guys, you apply pressure. You apply, ayan, pressure for about 3 to 5 minutes. Sir, sino ba mag-a-apply ng pressure? Eto, spill ko na ha. Spill the tea. Sino ba? Ideally, ikaw na ref ng procedure, kaya dapat ikaw lang din dapat ang mag-a-apply ng pressure. However, kasi, di ba napansin niyo ba yung mga, di ba napansin ba yung kumukuha ng dugo? I'm not saying na si medtech ha. Kasi a nurse can also naman perform venipuncture eh. Yung iba po, pagkakuha ng dugo, ay wala na lang, di ba? Ma'am, apply ka ng anong pressure, mama, sige po, labas ka na. Kasi guys, marami pa silang patient. Ganun yon. Pero pag wala naman masyadong patient, guys, dapat ikaw po talaga dapat ang mag-a-apply ng pressure. And ideally, as a phlebotomist, lalo na pag sa States, na pag hindi ka nag-apply ng pressure, tapos ayan, nagkaroon ng hematoma yan, pwede kang kasuhan. Magfa-file sila. Kaya nga, sabihin man natin na masarap ang buhay sa States, pero when it comes to healthcare doon, parang halos lahat mali. Na halos lahat may mali. Pwede kang kasuhan, di ba? Like, Diyos ko, no? Gustong-gusto nila yan. Kasi nagkakapera po sila. It's against the hospital, na so, babayaran sila ng hospital. And then, style na po yan ng iba. Sad to say, ang dami ding mga Pinoy doon na parang alam mo yung nagpapa-disabled na lang para kukuha po, 'di ba, ng aid, 'di ba? Ang tawag nila aid na yung mga aid po na yung government na magbabayad sa kanila, like parang nasa mga 5 I'm not sure kung $500 na per week or $300 per week, parang ganon. Basta a total of mga 1-2, okay, per month, na depende, or higher pa. Feeling ko mas mataas pa, na higher pa. So, ayun po. No? So, again ha, to prevent hematoma, guys, you need to remove the tourniquet first before removing the needle. You puncture at the innermost wall. Pag sinabi kong innermost, ayan, wala dyan. Na, i-draw ko na lang. Pag sinabi kong innermost wall, kunwari ito yung ugat po natin. Ayan, blue kasi unoxygenated eh. Vein kasi to. So kunwari ito yung needle po natin. Ayan. Pag dito kasi, ayan, may backflow na. Tama ba? May backflow na yan. Pag mag-advance na po tayo, ayan, dito ka sa innermost wall. That is the innermost wall. Advance po 1 millimeter pa. Estimate ka lang. Kasi what if no, sige advance ka tas dito na. Anong i-aspirate mo te bone marrow? So sumobra na po tayo, no? And ang pangit sa feeling kaya pag natamaan mo na yung buto ng patient mo, na mararamdaman ng patient 'yan, at mararamdaman mo din 'yan. So kaya kanina may backflow tas parang wala ka nang na-aspirate. So you adjust, 'di ba? Pero kasi no, bawal po yung yung fishing na tinatawag nila. Lalo pa po yung mga needle disengagement, no? Diyos ko. may nagfi-fishing talaga eh, no? Alam mo yung fishing guys, 'di ba? Hahawakan nila yung yung vein. Tapos ayan syempre ifa-follow nila sa needle nila. Grabe ang hematoma pag gano'n, no? So careful po tayo. Mararamdaman po ng patient natin na hindi mo talaga yan na-hit. Promise, mararamdaman yan nila. And sometimes kasi, na we need to be honest na lang. And ako minsan po, may technique kasi ako, lalo na pag nahihirapan talaga ako sa ugat, na kung paano, let's say, tusukin. Tatanungin ko muna, "Ma'am, mahirap ka bang tusukan?" Ayan, pag sinabi niya, "Oo." O, di ba? Totoo nga ang sabi mo, ma'am, na mahirap kang tusukan. See? No, at least, no, alam ko na mahirap talaga siyang tusukan. Pero with all my might, with all my powers din, trinay ko din naman eh. Na, pero sometimes na may mga patient talaga, lalo na pag anxious guys, sobrang nilang may fear talaga sila. Alam mo bang nagko-collapse po ang mga ugat ng isang tao pag masyadong kabado? Kaya dapat ipa-relax mo muna yan. Tanungin mo siya, ma'am or sir, what are the ways na that will pacify you para hindi ka masyado, okay, let's say, ma-stress, na ayan. Sabi niya, gusto kong mag-listen sa music. Na okay, sige, na. Tapos sabi niya, nurse, gusto kong umorder ka ng pizza. Hala, grabe. Kahit ako din, no? Syempre hindi mawawala ang stress ko. I mean, mawawala talaga ang stress ko pag pizza na talagang pinag-uusapan, no? So ayun po, no? So these are your hematomas. Ano pa ang mga common complication? Guys, if you're familiar with syncope, syncope is the medical term for fainting. Naalala ba yan? Your syncope, na that's the medical term for fainting or biglang nawala ng malay ang patient po natin. Kaya nga dapat talaga as a phlebotomist, dapat may background ka din sa BLS. Kasi what if nag-cardiac arrest pala talaga ang patient natin, no? Siyempre kukuha ka ng mga ng mga cardiac enzymes sa kanya, etc., 'di ba? And then biglang nag-heart attack, nag-cardiac arrest. So dapat ikaw din na phlebotomist, dapat marunong ka mag-perform ng basic life support po natin. Now, we need to identify a patient. Now, sir, paano ba mag-identify ng patient? Guys, huwag niyong gawin to ha. No? Others kasi naririnig ko eh. Good morning, sir. Di ba ikaw man si Ronaldo, sir, no? Daruka. Tapos syempre, si patient din. Oo na lang para matapos to. Na? Guys, huwag ganon. If ever kung magtatanong ka man sa patient mo, alam niyo ba ang asking the patient's name? That's actually the least na gagawin na po natin. Kasi the most accurate talaga way of identifying the patient is to look at the Cardex picture. Diba sa Cardex po, may mga pictures kasi yan ng patient natin. So yun talaga yung pinaka-best way. And then the second best talaga to identify a patient po is by simply looking at the armband ng patient po natin. Ang pinaka-last option na po natin is to ask the patient's complete name. Now, so how to identify a patient ba? Number one, you ask, ma'am, I want to know po, no, what's her last name? Ayan, what's her first name? Ayan, first name. And what's her middle initial, ma'am? Okay. Ayan. And then, no, I want to check also, ma'am, the ID number. Check ko lang, ma'am, ha, sa inyong armband. Ma'am, matanong ko lang din, ma'am, when is her date of birth? Ayan. Okay po. Na, Ayan. So, ayun guys. So, last name, first name, middle initial, the patient's ID number, and then we have the date of birth. And then, okay, kailangan mo ng, okay, what? Ayan, i-explain. Ganito kasi po, ma'am. Meron kasi pong, okay, ano po, order si Dr. Chua na for hematology po tayo. So, kukunan po kayo ng dugo. Okay po? And pag sinabi niya, ayoko. So, guys, you need to respect that. Why? Kasi the patient has the right to refuse kasi. Na, di ba, yung mga procedure, na mga treatment, na you need to respect that. Na just inform the physician. Na, so sure na po ba talaga ma'am na ayaw niyo po? Sige ma'am, inform ko lang po si doc ma'am ha. Ayun, tas doc, nag-iinarte po ang patient. Tapos i-inform mo na, doc, nag-iinarte ang patient, doc. Hindi naman pretty, char. Ganun kasi tayo mag-report, no? Na may halong chismis talaga eh, no? Hindi na siya factual, pero may chismis na. Hindi naman siya pretty, doc, pero arte-arte talaga ganun, doc. Kairita. Tapos sabihin din ni doc, oo nga, maarte nga yun. Na, nakita ko nga kahapon yun eh. Na, so, chismisa na agad eh. Yun yung mga precious moments na parang nawawala din yung stress ko sa work. No? Lalo na pag may nahalo ang chismis. Care with chismis, na is gold. Ayan, so we have already identifying a patient. Next po guys, labeling a specimen. Kanina nag-identify ka ng patient. Ngayon naman, mag-label tayo ng specimen. Siyempre sa tube po natin to. Now, in labeling the specimen, ulitin po natin. Ma'am, I'd like to know ulit, what's your last name? Ayan, what's your first name, ma'am? And what's your middle initial? Guys, magagalit ba ang patient dito? Yes. Nurse, or phlebotomist, but parang panay na tanong ka? Kanina pa yan na. Napapagod na ako sa'yo. Na, ma'am, para kasi po, no, hindi po makontaminate po yung mga ano natin and might lead to confusion. Diba? Okay, you need to shut your mouth na lang, ma'am. Just. We have the last name, we have the first name, then we have the middle initial. Next po guys, na syempre ilagay pa rin natin no, ang kanyang ID number. Ayan, the ID number no, or the hospital number po. Ayan, we have the time. Ayan, and date. Kailangan din po yan. And then lastly po, now we have the initials of phlebotomist. Initials, okay, of, ayan, phlebotomist po. So ako, Mark Jade Adlawan, so MJA. Ayan, so si Sir Rodolph, okay, Anthony Go, so RAG, 'di ba? Pero what if ang pangalan mo is Ronaldo Impuerto Purificacion? RIP, lahat ng specimen. Nakatakot naman. Pag ganun yung initials mo, no? Ayan. Hindi mo alam kung buhay ba to or Diyos ko, no? Signos na ba yan, no? So we have the labeling of the specimen po. Venipuncture equipment, na-discuss na po natin yan. Ito, this is the ABG equipment po natin, guys. For the ABG equipment, hindi masyado madami. Pero wag ka, meron tayong ABG, okay, needle. Itong ABG syringe po natin, pag nakadetect na po yan ng pulso, automatic siya na po ang aangat. Ganon kaganda ang ABG syringe po natin. Sa sobrang ganda guys, na hindi mo siya basta-basta mabibili. Hinalugog ko na ang Davao City. Sa Manila ko lang talaga siya nabili. So, ayun, nasad ako. Wala akong makikita ang ABG syringe dito. Kung meron man, siguro i-order ko lang sa Shopee or sa Lazada. Lahat naman po ay nasa Shopee, nasa Lazada na eh. 'Di ba? Na lahat na, as in like lahat na. Meron na nga silang mga doon, mga BVM na mga magaganda, like from China, yung mga pocket size. Nasa mga 5,000 na in terms of emergency. Sobrang ganda nun. Ako gusto kong bumili nun. No? So, ayan, in case lang, 'di ba, na may madadaanan tayo, may mga emergency, no? Kailangan kasi mag-intervene, na do not interrupt but rather you need to intervene. Okay? Pero ako kasi pag may mga emergencies po, lalo na dito sa Davao, tumatawag lang po ako ng 911. Next. And then, tatawag ako ng 911 na may emergency po dito, blah, 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 so and so. Alam naman mabababa ako guys, wala naman ako equipment. No? So tatawag na lang ako, at least kompleto pa yung equipment. Pero hindi ako alis unless na darating na talaga yung 911. Syempre makokonsensya din ako, no? And then, ayoko din kasing lapitan, honestly, yung mga taong na motor vehicular accident because my father died na with motor vehicular accident. So, partly, medyo traumatizing siya na event sa akin. So, ayun po. So, Kaya minsan pag tumawag yung 911, sir, are you there? No? Kaharap mo ba ang patient? Sabi ko, no. Nasa kotse ako, nasa side lang ako. No? So ayun, i-report ko lang kasi ayun, explain ka. No? So ganun. Na-try niyo na bang tumawag ng 911? Sobrang amazing lang. Like mararamdaman ko na parang feeling ko nasa US ako eh. Na Ayan, yun lang din yung kagandahan ng Davao, no, yung 911 namin. Kasi my brother works with 911 for almost 5 years. Yeah, ayaw niya na mag-abroad na kahit konti yung sahod doon sa 911, pero na-enjoy sila kasi masyadong ma-action. Kaya for those po na gustong mag-work sa 911, guys, magagamit niyo po yan abroad. Like mga EMT, 'di ba? Ayan, no? Pwedeng-pwede po 'yan, no? For those na gusto mag-work talaga. You can go sa sa Davao para mag-training po. Hiring sila ngayon, ambulance, 'di ba? Ayan. So ayun, no. Na-amaze din ako sa sa 911. So this is the order form or the requisition form po natin. Makikita po natin, na. So we have the patient's name, the patient's ID, the date of birth, no, the source of specimen, syempre blood dapat, no? Or let's say for hematology ba, no, ganun. So that is the order form. So let's discuss venipuncture. Now, with venipuncture po, no, I'll be playing a video. So again, the purpose of having this venipuncture, guys, is for you to diagnose a patient. Kasi once, ayan, purpose niya. Once, you diagnose a patient, then you're going to monitor, 'di ba, the patient. What is the angle? Pag venipuncture kasi, ayan, we have the 15, 'di ba, to 30 na degree, angle po. So, again, ano yung technique na ginagamit natin dito? Syempre, it's still the sterile technique po natin. And that will be best explained po na sa video na ipapakita ko. Ayan, roll VTR, char. O, volume up tayo. Guys.
Learning so we cannot vacuumize tubes. The equipment that we're going to need is obviously we're going to need our evacuated tube. We will need a barrel syringe. We'll need a hypodermic needle with a safety cap. We'll also need a transfer device. We'll need our gauze, our alcohol swabs, and of course our tape. Let's go ahead and tear off a piece of tape. Put that on the corner of the table. We'll need our tourniquet. Go ahead and apply this now. I've already asked my patient for consent and also explained the procedure. And I've previously washed my hands. Okay. So we're going to palpate with our 2 index fingers of our non-dominant hand. Maybe we need to ask our patient sometimes to make a fist. Okay. And found my vein of choice. Let's go ahead and landmark. Okay. Release. Assemble our needles. Make sure that our needles are in date and our syringe is in date. If this was expired, then we know that the needle and the syringe would no longer be sterile. With our syringe, you'll see that there's a lower tip in here. What lower means is thread, so we can thread this on like a screw. It's good and tight. Is that there? We'll go ahead and apply our gloves now. Okay. And we'll cleanse our patient right before we put our tourniquet back on. Start in the center. Circle concentric method, inside out. Place to the side. Place our tourniquet. Make sure that our ends are up. Have our patient make a fist. Okay. Go ahead and pull back our safety cap. Release the cap down. check our needle, make sure everything's okay with it. It's good. And also with the syringe, before you stick your patient, you want to pull back on the plunger to loosen it. Sometimes the needles has been sitting for a couple of years, so you just want to loosen the plunger a little bit before you stick the patient. Anchor your vein, and 1, 2, stick. You want to slowly pull back. With this test that I'll be performing, it's a serum test. I'll need 3 milliliters of blood. So very slowly I'll pull back the plunger until I have 3 milliliters of blood. I can tell when I have 3 milliliters of blood because my syringe is a graduate cylinder, which means it's been marked on the side. You'll see the blood slowly move in. Gradually pull back your plunger. This will take a little bit of time because obviously if we're doing this, our patient cannot tolerate the suction from regular tubes. It's also important to go very slow because if we pull our plunger back, we can hemolyze our specimen by pulling back the plunger too fast. Okay. And as we're doing this, keep in mind your patient may be nervous. It's okay to talk to your patient. It probably would put them at ease too. This could take a couple of minutes to draw the amount of blood you need. Okay. Looks like I almost have my 3 milliliters of blood. So what I'm going to do is I'm going to release my tourniquet, grab my gauze, fold it over once, fold it over twice, pull my needle out, apply pressure, immediately safety cap. In this instance only, we can sit the syringe down on our disposable chuck and finish bandaging our patient. Okay, we have our patient bandaged. Now the next step, since we drew this into a syringe, we now need to move it from the syringe into the evacuated tube. Very carefully, you'll unscrew the safety cap needle. Dispose of this in the biohazard. You'll need your transfer device. Make sure that it is in date also. Attach your transfer device. It screws in just like the needle. Turn your syringe upside right and insert your tube from the bottom. Make sure that you face your label away. This way you can see when the tube is done collecting. And just gently press in and let the vacuum do the work for you. All right. And then we disengage our tube and we'll invert 3 to 4 times. Okay. And we'll discard our assembly into the biohazard box. This time we'll go ahead and put our patient's name on, the date, time, and our initials. And we'll place into the biohazard bag and send our specimen to the lab.
Okay, the next topic will be the order of the draw. So you listen carefully. Ay.
Binubuhos mo lahat
May pa-bear brand tayo, guys.
araw-araw, kaya dapat matibay ang katawan mo.
Ngayon,
Sorry.
from the samples that
Hindi
we draw.
yan. Ito po.
This is the appropriate order of draw. Okay, the blood culture bottles do not have to be aerobic and then anaerobic, but they're just there to show you what's going on with them. Then it's the light blue, red. This is considered basically an SST tube as well. The SST, which is the gold, the lithium heparin, the potassium EDTA. These are 2 tubes. This is actually a bullet. You can see there's a smaller tube inside a really large one. And then there's the gray top tube. So now we're going to talk about what's in them. What do they do? So when you're going to draw a specimen from a patient and they do require a blood culture bottle, it's because they are thought to have septicemia, which is an active growing of bacteria in the patient's blood, and it is very deadly and a very serious condition. So we draw the blood culture bottles to actually try to grow them, and then we plate them and perform a gram stain on them if they're positive. And that way we can get a purified culture and figure out what the patient is actually suffering from and the best way to treat them. So when we do draw these, we want to use an alcohol prep to cleanse the site in which we're going to stick the needle from on the receiving end of the vacuum container. So there was a cap like this on this one, but I took it off here. So here we would use an alcohol prep and let it air dry. Do not blow on it. Don't wave at it. You don't want any environmental bacteria to get on there. And then, of course, we would put the vacuum needle in there and start the draw. Okay, so if that was the required one, we would then follow it up with all of these if they're required. You definitely would have a lithium heparin because you think of a lactate being necessary. Okay, so what is actually in these and how do they work? So there is a anticoagulant in here that pulls out calcium and is going to reduce complement from acting and being initiated in the patient's blood because complement does destroy bacteria. So we don't want them to die. We want them to actually grow. And it also slows down the phagocytosis and reduces any antibiotic therapy that they might already be on when they have been drawn. Okay, so if you'll notice here at the bottom, there's this disc. Okay, when these bottles go into an incubator, it's a special incubator for the bottles, and there is a light that shines through this disc every specified number of seconds or minutes or whatever it is that the manufacturer uses. And it's going to detect any changes in this color. There are also other blood culture systems that would detect to see if there is any cloudiness in the bottle. I did actually put blood in this a long time ago. I keep this as a, actually I think I put it in both of them. I keep these as purely demonstrational type of things, but to see if there's any cloudiness or clotting or anything in here, which would indicate possibility of bacterial growth. All right, now moving on to the blue tops. We talked about this in a coagulation video, but we'll talk about it again. So these are the same type of tube. They're a sodium citrate tube, as you can see there. They require a 9-to-1 ratio of plasma to anticoagulant. You can see the anticoagulant in there. And this anticoagulant pulls out calcium as well. So that the clotting cascade factors are preserved, and calcium happens to actually be one of the clotting cascade factors, and when it's pulled out, that eliminates the ability for the clotting cascade to happen, and therefore when you go to perform testing, you would add reagents that have calcium in them. So that way you get it to clot and you can detect any deficiencies or qualitative issues with the patient's factors or platelets using those tests. This is a serum tube. It is a non-additive tube, and or it could be a clot activator. And this is used for routine chemistries. The clot activator has silica in it and enhances coagulation. So we go from wanting to stop coagulation to wanting it to happen. Okay, because what we want is we want serum, and serum is the liquid portion of the blood after the blood has clotted. So this one we would spin down. I forgot to mention that too. The blue tops we would spin down as well and use the plasma from here. We would spin down and use the serum from up here and use it for chemistry. So the gel separator that might be in this one, you can see it in these two. Honestly, these are all used for the same thing. So see, there's gel in these. This is called a serum separator tube, SST, as you see at the top here. This is also an SST, serum separator tube. And what we're doing here is we're using this, this gel to separate the cells at the bottom from the liquid portion at the top. They don't always clot. You may have a clot within the liquid portion, and I do have a video on just squeezing that clot out, because the chemistries that you're looking for aren't really going to be affected if you squeeze the entire thing out. If you don't squeeze all of the liquid out of the clot, it will get affected. You may have, obviously, calcium be an issue if it's been clotted, but other than that, everything should be fine. Okay, so that's what this is about. Again, serum is the liquid portion of the blood after a clot, so we do want it to be clotted, okay? And therefore, calcium is not going to be an issue. I know I just said that, sorry. Calcium is not going to be an issue because you wanted it to clot anyway, so no big deal. Okay, so we're looking for our chemistries like the CMP, the complete metabolic panel, or the basic metabolic panel. Okay, moving on to this one. This one is your lithium heparin tube. Okay, and this can be used for all different kinds of testing, chemistry-wise. The sodium or lithium heparin, most likely it's lithium. Sodium isn't really used too much anymore, but it's used for stat chemistries. You would spin this one down too. You might have stat labs or point-of-care labs that use this. It can be used on a blood gas analyzer to establish chemistries. It could also be used for a lactate. If this was for a lactate, it would be brought down to the lab on ice. It needs to be on ice, or else it is inaccurate and you cannot use it. You would use this for ammonia levels and all sorts of things, okay? So if this is used for chemistries, depending on what it is, like if it's a heart panel, you would spin it down, but if it's a whole blood chemistry, then you wouldn't spin it down. Moving on to the next one. Okay, these are both, unfortunately this doesn't have a really nice label on the side, but these are both the potassium EDTA. Now, EDTA is a big deal for a few different reasons. These guys are used for blood banking. They're used for hematology, so CBC in hematology. They can be used in coagulation for the factor V Leiden. They're used in blood banking for all the testing that we do in blood banking. But they can also be a problem if they're outside of their correct draw. Okay, so notice here that it says it's potassium EDTA. There's possibly there is a possibility you might have sodium EDTA. It's not used as frequently as potassium. Most places use potassium EDTA, but that becomes an issue. Think about this. If you drew these specimens out of order and you had drawn a potassium EDTA in front of your chemistries, what do you think would happen? Okay, I'm going to tell you what's going to happen. You're going to put potassium into these tubes, and we know that the EDTA pulls out calcium. Okay, so on your chemistry results, you're going to end up with a very high, or a critical, or unmeasurable potassium, and a very critically low or unmeasurable calcium. You might end up putting this specimen on for like 2 times and it never ends up reading the potassium or the calcium. That is a big indication that the purple top was drawn in front of the chemistries. Okay, and that's a big problem, and we want to make sure that you know how to spot that. It is the most common problem, honestly. The order of draw ends up affecting your chemistries, and please don't ever report out those criticals, because then you're going to cause the patient to be treated improperly, and that could really affect their health care and affect you as well in regard to your experience and the possibility of you losing your job depending on the outcome of that patient. So please, please, please make sure that you remember that a critically high potassium and a critically low calcium would indicate EDTA contamination, and you should not report any of those results. You don't need to tell any other area of the lab really about that if it is an issue, unless there was another gold top drawn somewhere. Okay, so with the potassium EDTA, we have it all throughout the tube, as you see here. Again, with all of these tubes, any of them that have a gel separator or anticoagulant, you want to make sure that you are inverting them gently immediately after you draw the specimen, in order to make sure there is a complete and equal distribution of that anticoagulant or gel or whatever the additive is throughout the blood, because it's in there for a reason. So speaking of reasons, like we just said, with the lavender top, also known as the EDTA tube, you have the anticoagulant in there that is going to pull out the calcium. Again, it's an anticoagulant, so it wants to stop the blood from clotting, and the perfect way to do that is pull out the calcium. It also preserves the cellular morphology, hence why we would use it for a CBC, a complete blood count, because if the CBC is all crazy, then we do a smear review and we want to see beautiful cells. We don't want an in vitro issue to happen to cause us to think that something weird is happening in vivo, which means in the patient. So we're preserving the cellular morphology, and we're going to inhibit any platelet clumping using that EDTA. Okay, like I said before, this one is a bullet. If you can see in the middle, see the bottom of the little tube inside. These are usually used for babies. Okay, and babies need CBC depending on what's going on with them too. You might find them coming down from the NICU, and be very, very careful, and don't constantly cancel baby specimens, because they are highly affected by how much volume is taking out of them, and it could hurt them fatally. So you want to make sure to do as much as you possibly can off of any bullets that come down, whether they're a chemistry or an EDTA, because that baby is needing those results and is highly affected by the loss of blood. Okay, so then this one is your gray top tube, and it's a sodium fluoride tube. It can also be potassium oxalate, but what happens in this one is that you're trying to stop glycolysis from happening. Woohoo! Sorry, I forgot to say, I know I'm backtracking. You don't centrifuge these unless it's for blood banking or the factor V Leiden. Okay, moving on, sorry. You would centrifuge this one. This one is used for a fasting glucose, and the sodium fluoride prevents glycolysis and inhibits bacterial growth, while potassium oxalate is going to precipitate calcium, and it's going to give plasma for the glucose level. Okay, so in this, you have a difference between this result versus a random glucose result. In your CMP and your BMP, those are considered random glucose results. Your green top tube is considered fasting. If the patient is not listed as being fasting, draw, then this is not going to be accurate. Okay. And that's basically it. This tube is not a blood tube. This is a urine tube. So please make sure that you notice that. It does have a little bit of a preservative in here, but most of them do not have a preservative that's going to affect your chemistries of the urine. There are the little gray top, little tiny tubes with a little plug in the top, like this plug, except it's gray, and it's a really tiny tube that has boric acid in it, and you don't want to ever use that for your chemistry urinalysis. And if you do, then you can't result those results because they're not going to be accurate. But anytime you get a urine that comes down to you and it does have a microbiology culture on it as well, you need to send the tube first to micro. If you really need to get that urine done, then pour off the specimen as much as you need, keeping some in here as well, into a graduated conical vial. This is for urinalysis, but you need to have it labeled. Make sure it's labeled with the patient's information. You need to have at least 10 to 12 milliliters in there. If not, you can follow your laboratory's guidelines. But so you're preserving the cultural integrity of this tube if you recap it with the same plug and you just pour off into this. Do not send this tube to micro. They're going to be very upset with you and they can't really do anything with it. But they can do their culturing from here, and they're probably going to keep it, okay, and keep it in their refrigerator. So this way you have your specimen, you can get it done, they can get theirs done, and everyone can have the clinician can have the laboratory results as soon as possible. All right, thank you so much for watching. If you enjoyed.
Okay, so we're done na with our venipuncture, guys. So let's proceed na po sa ating next topic, and that's your... No, not that. Ito, ABG procedure tayo. Okay, with your ABG procedure kasi, you will be puncturing the artery rather. Yun talaga yung goal po natin, mapapuncture po siya. And then, as stated na din dito, the purpose of which is to determine for the O2 saturation. Yan, sulat ko lang. To determine, okay, O2 saturation. And aside from determining O2 saturation, guys, another purpose of your ABG also is, lalo na sa MEC vent, lahat naman po ay nakakita na ng MEC vent, lalo na in weaning the patient. Ayan, in weaning the patient, para tatanggalin na po natin yung tinatawag na tubo, 'di ba? Para hindi na po natin i-attach yung patient natin sa mechanical ventilator po. So again, your ABG is a highly invasive procedure which actually requires, kailangan po dapat may anesthesia dito. Kailangan po, no? So ayun. Ayan, nakaka-happy lang kasi buti na lang at na-develop po nila at na-discover po nila yung pulse oximeter. Kasi if ever kung wala po, always tayong kinukunan ng dugo, and malamang masakit yon. Sobrang sakit lang talaga nun. Okay po? Sige, so guys, ayan, I want you to pay attention po sa ating video. This will be the ABG video po natin. Hello po sa anak ni Ma'am Maria. Wala nang cocomelon baby. Phlebotomy na agad. Wala nang mga pang cartoons na diretso pang nursing na para yumaman lalo, 'di ba? Para mag-abroad lalo. Na si Ma'am, ano kaya ang course ni baby pag ma'am, paglaki niya, ma'am? Tanungin natin. Baby, gusto mo ba maging nurse? Ay, wait lang, ipa-unmute muna natin. Naka-mute kasi. I-interviewin natin si baby. What's your name? Baby girl. Naka-mute kasi. Okay, type mo na lang ma'am kung ano yung gusto niya. Ayun, ayun, ayun. Hello.
Nurse.
Gusto niya na
Nurse.
po maging nurse.
Gusto niyo maging nurse. That's nice na, very nice. Saan mo gustong maging nurse, baby? Sa Pilipinas or sa abroad?
Saan?
Kailangan.
Hindi niya parang po
Ay,
alam.
hindi niya pa alam. Mas sige lang, ang importante gusto niya maging nurse. Nakaka-happy na at least inspired siya sa kanyang mama. Okay, sige po, I'll be playing na guys na the video regarding ABG. Ay, si Sarah.
I love na my husband is so active. Sana yung aking magiging future family ay ganun.
Hi there, my name's Andrew. I'm one of the final year medical students. Could I just check your name and date of birth, please?
Sure, it's James Alexander, 13th of December 1989.
Nice to meet you, James. Today I've been asked to do a procedure called an arterial blood gas. This involves taking some blood from the artery in the wrist. I'm going to use some local anaesthetic, so it shouldn't be painful, but it might be a bit uncomfortable. Is that okay?
That sounds fine.
Can I just check before we begin? Have you ever been told you have problems with your circulation?
No.
Okay. Do you take any blood thinners, such as warfarin?
No, I don't know.
Okay. And have you ever been told that you have problems with clotting?
No.
Brilliant. Can I also check, James, do you have any allergies at all?
No, I don't.
Brilliant. I'll just gather my equipment. James, I'm just going to do a quick test to assess the blood supply to your hand. Could you just make a very tight fist for me? And hold it there. I'm now going to press on each side of the wrist. Keep your fist as it is. And relax.
So guys, this is the Allen's test. So with the Allen's test kasi, that will try to check na for the patency ng both ng ulnar at saka ng radial artery po natin. So that will try to occlude, i-occlude niya muna ang circulation. And then pag-release niya later, pag biglang babalik po yan, let's say within 7 seconds na or 6 seconds yung iba, pag biglang babalik po yan, meaning to say patent. So good candidate po tayo na for ABG. Kaso nga lang, this type of procedure kasi yung ABG, since kukunan tayo ng oxygenated blood, bawal po itong i-perform sa mga buntis because that can lead to fetal distress. Ayan, so ipapalpate niya na yan kasi dyan niya tutusukin po using a 45-degree angle. Pero pag if ever po, kung professional, like sobrang galing na talaga, nagna 90 degrees na lang po sila. Pero sabi kasi sa video, medical students, so magpo 45 degrees muna sila. Local anesthetic must be applied kasi ayan, malamang masakit to. Lalo na't ipo-perform niya po sa conscious na tao. So that's where the ABG syringe. You expel ng extra heparin. Ayan, nagpo 45-degree angle po siya. And then, ayun, no, may backflow agad. Expected po pag arterial blood, guys, it should be bright red as compared to venous, no, na dark red. Yan, bright red dapat.
James, that's the end of the procedure. Thank you very much.
Okay, with your ABG na procedure po, mapapansin po natin doon na dapat ilagay yan dapat sa biohazard bag. Na dapat ilalagay po yan. And then, usually gagamit po tayo ng mga chelated na yung mga ice para i-preserve po. No? Pero depende yan. Kung babalik ka agad guys, na let's say sa laboratory, no need for you to put that one sa chelated, na may mga ice, no? No, pero kung let's say mag-room around ka pa, no, like sa buong hospital pa, lilibutin mo pa, then kailangan na talaga ng tinatawag na chelated ice, ilalagay lang po natin sa biohazard bag. Ayan. For the complications naman, the same pa rin po. Very common ang hematoma. Very common din po ang tinatawag na nerve injury. Kaya careful po tayo in performing ABG procedure. Now, next topic will be the finger prick procedure. With finger prick kasi, the purpose of having your finger prick procedure is, 'di ba, kailangan kasi itong gawin, lalo na pag, pwede pong pag 12 years, 1 year old, na lalo na pag 'di ba na ano ang patient natin na diagnose ng dengue. Mahirap kasi pag always venipuncture tayo, guys, na. Pwedeng 1 year old, na. Ayan. And then for the finger stick po, na these are actually usually performed to patient na lalo na pag may mga diabetes mellitus. 'Di ba, this is for hematology kasi. Hematology, lalo na pag pediatric ang patient natin. And then this is for glucose testing, lalo na pag adults, no? Tapos may diabetes mellitus. And yun po. Ang importante lang dito, guys, na ang mali kasi ng iba, pag nag-perform po ng finger stick or na finger prick, hindi nila nire-remove na yung first drop of blood. You need to wipe off that first drop of blood. Wanna know why? Kasi it contains kasi excess tissue fluids. So pwede siya mag-falsely elevate na ang mga glucose na whatsoever. So dapat careful tayo, i-wipe it off. However, kasi yung iba, yes, nagma-wipe off sila kaso gamit ang may alcohol. Bawal po yun. And then ngayon din kasi, na we don't use cotton balls anymore, but ideally, ang ideal setup talaga, you need to make use of the 1x1 or 2x2 sterile gauze. Wala na po yung mga cotton balls. Pag may hospital pa rin nagpo-cotton balls, alam na this, 'di ba? Eh nagtitipid na naman. Ayan, sige po. So, ayan, I'll be playing the video po of finger prick procedure. This is the capillary blood glucose testing. Ayan, for a while. Or the dermal puncture.
Okay, today we're going to learn how to do the dermal punctures on each other. The equipment you'll need is you'll need a lancet. You'll need a lancet. You'll need your capillary tubes, alcohol swabs, your 2x2 gauze. Might need some tape, and you also need your gloves. Let's go ahead and put our gloves on. I've already obtained consent from my patient and informed them of the procedure. As you see, I have 2 lancets out. You want to make sure that you always have backup equipment in case the lancet does not work. Go ahead and withdraw one of your capillary tubes. Place it out. Be careful. You might want to sit it on something that you know where it is. Because it's glass or it's plastic, and it'll blend in with the environment. So try to make a mental note of where it is. Gather one of your alcohol pads. And you'll want to puncture the patient's finger, one of their 2 middle non-dominant fingers. So we'll go with this middle finger, and we'll point down using gravity as our friend. We're going to cleanse the fingertip. There's our alcohol swab there. And while the alcohol is drying, be aware that we do not want to stick center or medial in our patient's finger. We want to go lateral on either side. We never stick medial because there's a chance that we could puncture or break some of the bones in the finger. Also the same thing if we're doing a heel stick on a baby. We'll go lateral, not medial. Okay, so the alcohol is dry now. I have my lancet. It's already preloaded. Take off the cap. Squeeze the patient's finger and put up to the finger and push in. You'll hear it click. Means the lancet's punctured the finger. Squeeze. Wipe away the first drop of blood. With your capillary tube, red line facing down, go ahead and collect your sample. You'll try not to touch.
So guys, makikita po natin, gagamit po siya ng capillary tube. Yung red mark nun, it should be facing down. And make sure, squeeze ka muna, tapos make sure may dugo, kasi dire-diretso yan eh. And alam niyo ba, if ever po kung mapasukan po yan ng air, ibabalik po yan sa inyo. Masasayang lang yung specimen po natin, madi-discard lang po siya. So dapat wala talagang air as much as possible.
Touch the capillary tube to the patient's skin and just dab on the bubble of blood. And you'll do this until your tube's full. Allow yourself plenty of time. At this time, it might be best to talk to your patient. It's a slow process. More than likely, we'll be performing these punctures for the finger stick. We'll do on children that is past the age of toddlers up until adolescent years. And if it was an infant, we would use the heel. Sometimes we'll do this on geriatric folks. They may be a little bit anemic, or their veins cannot handle the vacutainer system. Capillary tubes are heparinized. Okay. All right, and my tube is full. Place this down on my disposable chuck. Patient a piece of gauze, and ask your patient to hold that. And this is how you do a dermal puncture. And at this point, depending on your facility, you would go immediately process your capillary tubes or take to your lab. And this is how you do a dermal puncture.
Okay, questions po? Questions, clarifications? Sige nga, tignan ko muna. Pa-on muna ng mga videos po nila. Ayun, ayan naman si baby. Ayan, so my last topic guys will be all about the the newborn screening kasi this is the heel prick okay method kasi. So this will be the last topic po. Okay? Sige. Don't worry, wala naman po tayong post-test eh. No post-test po sa phlebotomy. So it's up to you whether you want to avail po the certificates na makukuha po natin. No? So nasa sa inyo lang. No? So i-comment na lang yung iba kasi ang alam ko kasi ang enrolled po is nasa mga 4 or nasa 5. No? So it's up to you, no? Nasa inyo na po 'yan. For a while i-click ko lang.
Shopee Payday Sale na! Kaya i-check out mo na yan! Shopee!
On behalf of the Texas Department of State Health Services Newborn Screening Team, thank you for the work that you do to ensure that every baby in Texas receives the best medical services possible for a healthy life. This short video demonstrates the proper procedure for collecting a newborn screen blood specimen. We will also give you a few collection tips and show you some things to avoid. Thank you for taking the time to watch and for your support of the babies and families affected by disorders identified through newborn screening. Your actions can save the lives of Texas babies. Let's get started. A successful blood specimen collection begins with these necessary supplies: a newborn screening specimen collection kit, a warm, moist, soft cloth or a heel warmer, alcohol-wetted pads or cotton balls, gloves, a heel lancet with a tip depth of 1 millimeter and a length of no more than 2.5 millimeters, sterile gauze pads, and aftercare supplies such as Band-Aids or gauze. To get started, make sure you complete all the information on the demographic portion of the collection kit. It's very important that all information is correct and that it can be easily read. Next, position the infant's feet below his or her heart to increase blood flow. Make sure you check the identity of the newborn before you start the collection. Then, warm the heel with a heel warmer. Or you may use a wet cloth that has been soaked in warm water no higher than 41 degrees Celsius for 3 to 5 minutes. We warm the heel because it increases the blood supply to the area.
Ay, nawala ata. Tama ba ako? Nag-stop siya, no?
Yep, nag-stop.
Nag-stop siya. Wait lang ha. Internet ata to eh. Yes, for a while lang po ha. Kasi parang nagkaroon ng problema sa internet po. Mhm. Nawala nga. Okay, for a while. Ayan. Before I'll continue sa we pump, may announcement po ba? Parang nag-lag lang ata to. We pump, may announcement. Yeah.
Hello, Sir Mark.
Ayaw.
Good afternoon.
Hi, ma'am. Hi, Ma'am Joy.
Yes po. Invite ko lang po yung iba. Baka may kakilala po sila. Yung next schedule po natin is on March 3 to 4. Yes, BLS-Acls and First Aid naman po yun. Baka meron silang colleagues na interested.
Okay po.
Thank you.
Thank you po.
Once you've cleaned your hands and put on gloves, you're ready to start the collection. The heel puncture, also called a heel stick, should be made on the sole of the foot. These are the safe areas for getting the blood specimens. Do not use a previous puncture site. We use the safe areas to reduce the possibility of causing damage to the bone, nerves, or tendons. Before you do a heel stick, clean the heel with an alcohol pad or an alcohol-wetted cotton ball and let the skin air dry. We do this because any alcohol left on the skin may dilute the blood specimen. This can cause test results that are not normal. With the heel lancet, stick the heel at a slight angle. Wipe away the first blood drop with a sterile gauze pad. Allow a second, large blood drop to form. We do this because the first blood drop is likely to contain tissue fluids that will dilute the specimen. You can use either side of the filter paper for this procedure, but apply the blood drops to only one side of the paper. Lightly touch a large blood drop to the filter paper. Let the blood soak through the paper. If the first drop of blood doesn't completely fill the circle, quickly express another blood drop and continue to fill the same circle. To help the blood flow, you may apply very gentle, intermittent pressure to the area surrounding the puncture site. However, do not milk the heel or the puncture site. It's important to follow these procedures. Please do not go back to circles partially filled and add more drops of blood. The specimen is not acceptable for testing if it is oversaturated, layered, or clotted. Fill each circle one at a time until all 5 circles are completely filled. We do this because 5 completely filled blood spots gives the state lab enough blood to test for all of the genetic disorders. And if a result comes back abnormal, there will be enough to complete the testing before the result is finalized and reported. When you have finished collecting the blood drops, follow your normal procedures for care of the heel stick site. After taking care of the infant, put the collection kit on a dry, clean, flat, non-absorbent surface. You can use a drying rack for several kits. Let the blood spots dry for a minimum of 3 hours. You are now ready to send the kit to the state lab. When special situations arise, or if you have questions, contact the DSHS Newborn Screening Lab for assistance whenever needed.
Ayan. Wait lang ha. Stop share ko lang. Ayan. Sige po. Questions? Are there any questions po? Ayan. Sir Rodolph. Ayan. May questions po ba? Like Ma'am Maria, Miss Avis, Miss Alisa. Ayan, yung naka-iPhone po natin. None naman po. Hi, Sir Rodolph. Ayan, saan mo pa paggagamitan, sir? Yung yung phlebotomy natin. Magwo-work ka ba, sir, as a phlebotomist or pandagdag sa resume po natin? Pandagdag, yun yung gusto natin. No? Para pag nabasa nila sa mga resume po natin, no, competent to, yung competent, no, highly competent yung nurse na to. How about, no, kay Ma'am Maria? Ma'am Maria, what's the purpose of having this training on your end?
Para pag nasa COVID ward ako na lang mag-extract ng blood.
True, 'di ba? And then, magagamit din natin 'to if we want to apply for a PDN, 'di ba? As PDN, kasi at least tayo na mag-extract ng dugo, tapos isi-send na lang po natin sa lab. Na at least yung pambayad nila for medtech, no? Kayo na lang din ang gagawa, 'di ba? Yun yung mga benefits nito. How about kay Miss Aliza? Miss Aliza, ano po ba yung purpose ng training na to, ma'am?
Dagdag lang po sa knowledge sa dialysis.
Sa dialysis po natin. So ayun, for sure, no, with the videos kasi, pwede na tayo mag-perform ng ABG. Lalo na pag ulit-ulitin po natin yung mga videos po natin. Although kasi makukuha niyo po yun, no, sa WePump din. Kasi recorded na po yun lahat. Okay po? So Ma'am Joy, thank you so much. Na WePump, thank you so much. No? Ayan. At the end of the day, at least na-deliver po natin yung mga dapat po nating i-deliver and part po ng natin, ng scope of po natin. Yeah, for today. Ayan. Sige po. So okay lang ba guys na mag-pictorials tayo ulit? Ayan. Kasama na po si future nurse po natin, si future RN. Na anak ni Ma'am Maria. Oh, what? How about si iPhone? Miss ayun. No? So sige po, picture tayo guys. So 1, 2, 3, smile. Isa pa. O yung heart natin para Korean. 1, 2, 3, smile. Thank you so much and have a blessed day. And then of course, the rest of the week guys, mag-ingat po kayo. Thank you for choosing WePump. And then yung next training po namin March 3 and March 4. Ingat po. Thank you. Ingat.
Hello po, yung recorded po ng webinar po, i-send po namin kasama po ng IDs po and certificate po through Gmail account po. Thank you so much po.